Hello and welcome to the Love Mia Vita podcast, sponsored by Fem Pharma. I'm Jerry DiPiano, founder and CEO. Thank you for joining us as we discuss all aspects of women's healthcare. Please note, this podcast is for educational purposes only. Always refer to your healthcare practitioner for personal advice. Welcome, Dr. Victoria Clement, to the Love Mia Vita podcast. And today we're going to talk about a topic that is probably of interest to women of pretty much any age group cohort, because it's something that may affect you at any age, depending upon different conditions or different life experiences that you may have. And that's the topic of incontinence. Dr. Clement is well qualified to speak on this topic. She is a pelvic floor physical therapist who is both an exercise scientist, but also has a doctorate in physical therapy and special credentials in pelvic floor physical therapy. What did I miss, Victoria?
You covered basically everything. Thank you so much. I actually got certified to be a birth doula too, so I have knowledge in that realm as well.
Excellent. So she is your go-to person if you need anything having to do with the pelvic floor. And she actually has a professional practice called Restore the Floor.
Yep. That's how everyone knows us, and I think that's so funny because it's so catchy. The practice is Restore Physical Therapy and Pelvic Health, but Restore the Floor is perfect. I love that.
Excellent. So when we speak about incontinence, we know that there are different types of incontinence, and some of this is exacerbated during genitourinary syndrome of menopause.
Mm-hmm.
But when we think of incontinence, we shouldn't exclude women who are younger who may have different types of incontinence. It's not to say that they can't have all three. So there's stress, there's urge, and there's mixed. Perhaps you can help our audience to distinguish between the three types of incontinence to start off with.
Absolutely. So I think of stress incontinence as you don't have an urge, but there's some kind of pressure going through your abdomen which causes you to leak. And that pressure coupled with a weak pelvic floor is the recipe for the leaking. And that pressure could be sneezing, coughing, impact activity like running, lifting heavy, jumping, but also just like doing something quickly too, like getting out of bed quickly. That pressure going through your system can definitely cause that issue.
So that would be your stress incontinence. Then you
Yeah.
have urge incontinence, sometimes referred to as overactive bladder.
Yes, exactly what you just said. That's more, you have an urge, but you have that urge quickly. Like immediately you need to get to the bathroom. And that can, again, be caused by overactive bladder or also like a nerve signaling issue. So the nervous system isn't sending the right signals to the bladder.
And we know that with overactive bladder, you might have reduced bladder capacity, so your bladder cannot hold a lot of urine. And we know that that is a condition that is typically addressed with pharmacology. We know that because FemPharma has done a lot of research in the area, clinical research in the area of overactive bladder, and that is something that pharmacology may ameliorate. Then there's mixed incontinence.
That is basically a mix of both. So you could have a little bit of both stress incontinence and urge incontinence happening.
So incontinence sometimes companions, sadly, with fecal incontinence. It's not something that we're going to discuss today, but you can also have a combination of both urinary as well as fecal incontinence. And sadly, these are things that women don't always discuss with their healthcare practitioners, and they are the cause of significant embarrassment, sometimes isolation. So there really is a toll on the quality of life for women who experience any one of these types of incontinence. And so today, what we want to talk about is hope, because there is hope. And we want to talk about the different age group cohorts that are affected by, in particular, stress incontinence. And as you said, this is really a pelvic floor issue, and it's something that you know very well because you've worked with women who have stress urinary incontinence. So let's talk about the underlying causes, or I should say the groups that are affected by stress incontinence? You mentioned some of them briefly.
Yes. So, of course, we think of our pregnancy and postpartum populations. Your body goes through a lot of changes. There's some weaknesses happening as a result of compensation. And then you, of course, have pressure on your bladder from the baby. So, that population in particular is definitely affected. And of course, going along with menopause as well, you have a decrease in estrogen in your body postpartum and in menopause. So with decreased estrogen, you have less strength of your pelvic floor, more less of that bulk and strength of the muscle fiber. And then there's more irritation as well that goes with that. So that irritation can cause more of that trigger to go, more of like that urge incontinence, but coupled with that weakness, it could end up being both the mixed and the stress, like the stress and the urge incontinence.
So with women who are postpartum, I've heard this and I've heard this and I think it's a myth, but you'll tell me if I'm correct. If a woman has had any pregnancy, she may have stress incontinence, even if she has a cesarean section.
Yes,
Solely, or I should say, it's not exclusively impacting women who have had a vaginal delivery. It could be women who have a pregnancy period and a weakening of the pelvic floor. Is that right?
definitely. And it can also affect women who have had surgery. So you don't even need to have a baby or a C section. Any pelvic abdominal surgeries can cause that weakness and that stress incontinence.
So if you've had, say, surgery for a fibroid or for endometriosis or any
Mhm.
sort of pelvic, I would say invasive pelvic surgery.
Yes. Even hip surgery and back surgery. So if you've had lumbar pain, had a surgery to help with the root of your spine or a decompression surgery or even a hip surgery, those can affect the pelvic floor too because it's all interconnected.
And what about female athletes? Because sometimes we hear that we actually had worked here with a clinical coordinator who was young, had not had a baby, but she was an extreme athlete and
Yeah.
she had stress urinary incontinence that she talked about openly.
Yes. Again, she probably has so much pressure going through her system, and we develop patterns that are not the best sometimes. So it's great for your sport, and we go through that same like movement or a couple of movements quite often and your body gets used to that, but then other muscles compensate, and so your pelvic floor might tighten and weaken to compensate for those movement patterns. And then if it's something like sprinting or any impact at all, any weightlifting heavy, that can put more pressure through your system as well.
What about we hear a lot about the Kegel exercises and Kegel exercisers, so the tools that women use. I've never tried one. I think I'm terrified thinking trying to insert something that, that might be electric and, could do damage because I don't know what I'm doing. But do they work?
They can if somebody's having trouble connecting with their pelvic floor. So if we give them cues in PT to close the sphincters, lift, and they're not able to do that with different cueing, that might be a great tactile cue for them. I would recommend that people do it under the supervision of a professional though, and not just off the counter by themselves, because you need to understand like what you're looking for and what you're trying to feel for.
Good. That's really good advice. As I said, for those of us that have had babies, that was the advice after we delivered. Make sure you do your Kegels. And I guess I was doing them correctly because I don't have SUI, but yes, yeah, one of the lucky ones. But there are 20 million women in the United States that suffer from some form of incontinence. So it's not trivial. You are not alone. And there are things that can be done. And you mentioned some of the factors. Pelvic floor PT is something that has really just exploded in the United States. So let's talk about pelvic floor physical therapy and the ways in which it can support women who are experiencing any type of pelvic floor issue, but in particular the stress urinary incontinence. So how is it done? Who are the candidates for this?
Basically anybody could be a candidate for this. Even we think about it as prevention too. So we don't want people to face these issues. And if you can come to PT and get assessed and prevent that, that's great. But when you come into our office, we assess everything from the torso to the feet. So your ribs stacked on top of your pelvis is a factor. How you're moving, how you're breathing with your moving, what muscles are weak, which ones are tight, which ones are strong and we're overworking. We need to balance all of that out. We test this because going back to more of that urge incontinence, even stress incontinence as well with posture, if your spine is off and very tight, that affects your nerve signaling, that affects your posture. So we're always checking the spine and hip health too. We do internal and external exams as well. So they might sound scary to people, but they're actually very telling, very comfortable. We do not do them unless people consent. But essentially, what we do is insert a finger within the vaginal canal to assess those deeper muscles. And we can help release them while we're there. We can help train you, be like that machine you were talking about earlier, give you those cues on how to do the correct Kegel, a full Kegel, making sure that people are contracting all of the muscles and not just the bottom of the muscles and using their butt muscles instead. Um, and then we bring it all together. So if people need the hands-on therapy, whether that's pelvic floor or the surrounding structures like your hips, your back, your hip flexors, thighs, even feet, we work on all of that. We can give you exercises to address what we found in the eval. So if something is weak, we help you get it stronger. If something's really tight, we figure out how to lengthen it. And then our ultimate goal is to get people stronger and breathing correctly to protect their pelvic floor with functional movement. So we usually end with like the squats, the deadlifts, the higher level exercise, even HIIT workouts where you're adding a cardio component to it. We want people to be resilient with their functional exercise and functional daily activities.
So do you, for the, I would assume that you would look at the physical characteristics of each individual. So if a woman comes in, let's say she's had hip surgery, she's in her mid-50s, and she's experiencing stress urinary incontinence, and maybe she hasn't exercised in quite a while because she's had the hip surgery. I'm assuming that you would have a different treatment plan for her than you would for, say, a 30-year-old who was postpartum and perhaps had, a very difficult pregnancy, let's say, or a difficult delivery.
Definitely. There's some similarities between the two, but definitely some individual factors that we take into consideration. So the person's history, so like where they came from, what they've been through, any information about surgery or the birth, and then what's important to them. So what might be important to the person that had the hip surgery might not be important to the person that had that's postpartum from having their baby. So making sure that we tailor their program to meet their needs is the most important thing, honestly.
Is there a standard course of treatment for this? Is there, like does it work in 5 weeks, 6 weeks, 12 weeks? Not, it depends on the individual. So what does a typical course of therapy look like? Or
If
isn't
it
it typical?
It might not always be straightforward, but if it's a typical straightforward stress urinary incontinence, that can usually take about 2 months to get better. Some people have other factors to consider. So, like, they might have back pain with it, or a tight hip, or they're newly postpartum, and that can take a little bit longer with the healing of that going on at the same time and trying to rehab. So it depends on the person's factors, how often they can go to PT or stick with their program at home, and if they follow the program.
So assuming somebody comes in to see you for the first time, you're taking a history, you're assessing them as you described.
Hmm.
Is it once a week, twice a week? Does it depend on the frequency with which the person has availability, or what is it that you should expect if you're going for pelvic floor PT?
We see people once a week. And we'll reassess in about a month to see how they're doing. If they're doing better, we'll decrease the frequency to every other. We typically see people 6 to 8 visits in total.
So on a weekly basis or on a monthly basis?
I would say weekly to start. And
Okay.
then after 4 visits, we could try every other week. And then we'll give them a month to see how they do. And after that month, if they're feeling great, then we discharge.
Do do patients regress? So I'm guessing that if you don't practice some of the techniques, you can begin to experience symptoms again.
Definitely. If you're not doing the homework or at least applying the principles to your daily life, it's not going to work.
So let's talk about the homework for a moment.
Sure.
So so you come in, you've had 4 visits,
Mhm.
you get an assignment. Describe the assignment.
Sure. They could be variable. So most people get around like 4 to 5 exercises to work on, and we can even simplify that too to make it like a circuit workout. So we could do 2 exercises that you're focusing on, and you're only doing them for 8 minutes. On 1 minute, do the 2 rounds, and then you get rest. So we can make it a workout to make it easier to include into your daily life. Other people need education. So another thing that we do is like a bladder diary or a bowel diary. So that keeps track of when they're leaking, if they're having urge symptoms, and trying to see if it's related to their diet, their habits, their sleep, their hydration, getting a bigger bird's eye picture of their life and seeing if we can make changes within that.
We would always assess behavioral issues when we would run clinical trials because we wanted to see if women were complaining that they had overactive bladder. It's okay. The frequency and the volume of consumption of liquids, what kinds of liquids? Is it water? Is it coffee? Is it alcohol? So what is it that you're consuming? How frequently are you consuming it? And then tying that to bathroom visits, because we looked at bathroom visits, otherwise known as micturitions, as well as incontinence episodes. But it was fascinating to see what women thought might have been overactive bladder when they're consuming gallons of water, and then, or they've trained their bladder to do what mom always taught us, which is before you leave the house, make sure you go to the bathroom, even if you don't
Yes.
have the desire to go. So you've conditioned your bladder, right? So you've
Jicking
trained your
just in
bladder
case.
just in case, right?
Yeah.
The just in case, which isn't always the best strategy, because you can train your bladder. So yeah, so I can relate to that. But so if you are an individual that has followed all the, prescribed homework, you keep the diary. Is this a diary that you provide? Is it something that you ask your patients to just write down or put in their phone?
We give them the outline of what we want. So it's like a PDF. They can print it out if they want. They can fill it out online if they want. Whatever they prefer.
And will they bring that to each visit?
Yes. We only need about 3 days of like 3 consecutive days to see exactly what's going on.
Great. And then if you've done all that, that is probably you can maintain this the benefits of what you just explained for
Mhm.
years. Does it
Yes.
does it recur?
It can happen in instances such as like illness. If you get a really bad illness where you're coughing and sneezing a lot, that can affect the pelvic floor and you might have to come back. But our goal is to give you tools to take home and help prevent that from happening. So we give people wands and dilators. They have access to their whole program for a lifetime, so they can refer back to those beginning building blocks and do that. And then if something's not going right, we can reassess.
And if you have, let's say if you have talking about the women who are postpartum,
Mm-hmm.
if they have multiple births, do they often have to come back, or is this something that once and done?
I believe they should come back. So the body's different after every birth, during and after. So the changes that happen during your first birth might be different the second time. So it is good to at least get an assessment to see if anything's different, especially if you're having symptoms. A lot of people do feel more confident with their second birth had going through physical therapy during their pregnancy and postpartum journey the first time.
And let's say you get a woman who has vaginismus. She also has stress urinary incontinence. So vaginismus, right? So it's, this can be problematic because this woman is probably also not having intercourse. So there might be some vaginal tightening, there's pain. How do you work with a patient who has those combination factors?
So we again talked to them about what's happening. So did they have a surgery, an injury, a trauma, and proceed with care either way. If there's somebody that isn't comfortable with a pelvic floor exam, we can show them strategies to help us gain information by doing it themselves. So, whether that's observing the pelvic floor with a mirror, using those tools like wand, dilator, or even a digit, a finger, to assess themselves and tell us what they're feeling, of course, like as they're comfortable. And then if someone is comfortable, we do the internal exam. We're assessing the tissues. Is there inflammation? Is there redness? Is there weakness, tension? And address each one as that. There are people that do need lubricants. So, like specialized lubricants that help um, with the inflammation, kind of cool that down a little bit. People that need that estrogen in their vaginal canal to help with that muscle plumping and help with that irritation that they get. So we have a couple products that we recommend, but also sending to a physician that can help as well.
Yeah, it makes sense. I mean, we often hear from women who have had overactive bladder, stress urinary incontinence, mixed incontinence, and they've been using pads, or maybe they've been using an insert, just a pelvic floor insert, a paper insert. They find it difficult. They experience chafing, irritation, and those are the same women that will ultimately use a personal lubricant and vaginal moisturizer, maybe a vulvar moisturizer, because they've used pads a lot. They're wetting themselves, so they've created some more irritation because they're constantly wiping. So it makes sense to check in with your healthcare practitioner in addition to your doctor of physical therapy. And for women that are listening and viewing this podcast, the doctor of physical therapy that has the credentials that you do with certification in pelvic floor physical therapy is different than a physical therapist or even a doctor of physical therapy. And perhaps you can share a little bit about the special training that you received and why it's important when you're selecting a pelvic floor PT to look for that credential.
Sure. So, not all physical therapists are pelvic floor physical therapists, and that's the key. And not all, so some pelvic floor physical therapists say they can help you, but they don't do the internal exam either. So, it's important to specify if they do that or not, because that can be different. I've personally gone through hundreds of hours of postgraduate training to do this through Herman and Wallace, through various companies. I've kind of gone the way of the athlete, so I've done more athlete focused courses as well, and then the doula training. So it does require a lot of extra training to be able to do this and to understand it well for our patients.
And I think you illustrated that it is extremely important if you were going to have an internal exam to find someone that's actually had the specialized training that you describe. We want to make sure that you feel comfortable, but that you also get someone that knows what she is doing during that exam.
Yes, definitely. That's number one.
So this is great information for women who are listening in. And as far as your practice, I know you're in Pennsylvania. So for anyone that's watching or listening, where can they find you?
We are in the Philadelphia area. So we have two offices in the city and then two in the suburbs, the main line in Montgomery County. So we are basically all over Philly. And you can find us on Instagram too. So I post a lot of content. We're Restore PT Philly and Restore the Floor DOC on Instagram.
So even if you're in Seattle, Washington, you can learn about pelvic floor physical therapy, and you can learn more about your body by checking in with Dr. Victoria Clement and her team of experts.
Yes. And if you need somebody, like if you are out of state and you need help, I'm happy to find you a qualified provider in your state too. So you can have
Right.
that person treatment.
So you just heard it from someone else that advocates for women. Dr. Victoria Clement, thank you so much for being
Thank
our
you.
guest.
Thank
We
you for having me.
We are so happy to have met you and have had you share your expertise on pelvic floor physical therapy. More to come, lots of different ways in which pelvic floor PTs can help you. And we hope to have you on again as our guest.
Me too. Thank you so much.
Thank you. And remember to love Mia Vita. Thank you for joining us on the Love Mia Vita podcast. Love Mia Vita means love my life, and that is a mantra we should all live by. Please like and subscribe wherever you get your podcasts, and remember to follow us on social media and on fempharma.com. Thank you and be well.